Hello, my name is Dr. Judith Kahn. The purpose of this video is to share some osteopathically-based techniques that can be used both by health professionals and lay people during the COVID-19 epidemic. I'm a physiatrist, a medical doctor trained in physical medicine and rehabilitation. I've been studying and implementing osteopathic techniques in my medical practice since the 1990s. I live in New York City, which is a major epicenter right now of COVID-19, and have been reading extensively about COVID-19 and other pandemics. People are experiencing respiratory distress, being placed on ventilators, and cytokine storms are being reported. I have become motivated to share manual therapy approaches that may be of additional benefit in this critical situation. During the flu epidemic in 1918, the lowest mortality rates were in patients treated by osteopathic physicians. Osteopathy looks at the whole body and typically starts treatment at the area of greatest restriction or tightness in order to achieve maximal benefit. In view of today's situation, I'm going to demonstrate techniques that are specifically directed to the chest region, as COVID-19 has been affecting the lungs and chest to a greater extent than other body regions. However, the principles of these techniques can be applied anywhere else in the body using your intuition to identify other areas that also have soft tissue tightness and restrictions. These techniques may be used by therapists who are actively practicing at this time in nursing homes and hospitals, and can be utilized by any health professional on the front lines. In more critical cases, it is especially important to avoid using any force, but to just allow your hands to rest on the recipient's body. My goal is to have those practitioners who are already in contact with COVID-19 patients add in these techniques when feasible. In addition, lay people may use these techniques on themselves or on those with whom they are in isolation. The first step in applying these techniques is for both the practitioner and the recipient to be as calm and centered as possible. Some helpful ways to do this are to feel a connection between your feet and the ground, and to take several slow, deep breaths into the abdomen. There are YouTubes demonstrating breathing techniques and progressive relaxation that may be of benefit in these times, even without the application of manual therapy techniques. The use of calming music, uplifting movies, and uplifting books may be helpful in general. I will now demonstrate the techniques that I want to show on my husband, Roger. Ideally, these techniques should be done directly on skin. Currently, gloves will need to be used when you are in a situation where precautions are being applied. However, if you are using these at home and on yourself, strict hand washing practices may be used instead. The first technique is a diaphragm release that can be applied over the breathing diaphragm at the bottom of the ribs, and additionally over the top of the chest, over the thoracic inlet, over the top of the lungs. So Roger, if you would come here and sit down. Using gentle pressure, just place your hands over the lower ribs. So one hand will come right here at the bottom of the ribs in front, and the other hand will go on the bottom of the ribs in back. And visualize an overripe tomato between your two hands. And start with just enough pressure on this overripe tomato to make sure that you do not squirt yourself with any tomato juice. As the tissues relax and your hands sink in, you will come to a restriction or barrier. When you reach this point, just wait and allow your hands to just gently rest as the tissues soften. The softening may feel like butter melting under your hand, and your hands will continue to be gradually invited in till you reach the next barrier or area of restriction. And while you're doing this, you can ask the recipient to breathe down into your hands. Even if the recipient is not fully conscious, they will hear your calm voice asking them to do this, and that may be of help. And you'll stay here for 3 to 5 minutes, and as long as there are still more barriers that you're reaching and more softening, you can stay here for longer than 5 minutes until you feel that there's no more barriers that you encounter. When you're done, you will take your hands off softly and gently. Remember, when your hands are on, you never force the tissues. The same thing can be done at the upper diaphragm, at the thoracic inlet. So one hand will come right over the collarbone and upper ribs, and the other hand on top of the upper ribs and back. And again, my hands are applied gently, and they gently sink in till I reach a barrier. I stay here waiting for the restriction to soften, for the tissues to melt, and for my hands to gently sink in further. Again, I can't emphasize enough, never force. Just allow the softening to happen, reach the barrier, let your hands rest there, stay present and grounded, stay connected to the person, and allow them to feel your hands. Focus on the feeling, not on conversation, and just allow the tissues to soften. I'm demonstrating this on Roger as he's sitting up, but it can also be done with him lying down. I can be standing at his side or sitting in a chair. One hand would go underneath, or I could have him roll to the side to put my hand underneath and come back onto my hand. And the other hand is on top of the lower ribs. The bottom hand is beneath his lower ribs. And again, I'm feeling that overripe tomato between my two hands and allowing my hands to soften. The upper respiratory diaphragm, one hand is just at the collarbone and on the upper ribs below that, and the other hand is underneath over the upper ribs at the top of the back. And again, I rest my hands gently, allowing the tissues to soften and allowing my hands to gently sink in, go into a barrier, waiting for the tissues to soften and allowing my hands to sink in further. When there are respiratory issues, the tissues may be very, very thick, and it may take a while for barriers to soften. Just be patient. Roger, if you'd sit up again. Facing the camera, please. The next technique is a technique he can do on himself, or I can do on him, which is to put hands on the front of the chest, on the upper chest basically, or middle of the chest, one hand on each side, and just let the hand sink in. So he can do this on himself. People can do this for 5 minutes at a time or longer. Relax your hands, and I can do it standing behind him and just resting my hands on the front of his chest or on the top of his chest. The last technique, if you lie down again, is a technique that can be calming for the whole system. And in this technique, one hand is placed under the back of the head, and the other hand is placed at the base of the spine under the bone at the bottom of the spine called the sacrum. And I just rest my hands there. You can also do it with him sitting with your hands behind these two areas, but that can be uncomfortable for the practitioner if the hands are not properly supported. So lying down would probably be the better way to do it. And you just rest your hands here and just let the weight of the recipient's hands sink into yours. Thank you, Roger. These techniques may be repeated several times a day. Again, for a minimum of 3 to 5 minutes for each technique, or longer if time allows and you're still feeling more releases of the restrictions. Again, I cannot emphasize enough, never force. This is an imperfect YouTube in an imperfect time. Ideally, one would have hands-on experience to learn these techniques and experience the techniques on oneself to enhance your ability to do it on others. However, it is my hope that healthcare professionals will extrapolate from their current knowledge and training, and that lay people can follow my descriptions as well. At best, these techniques may improve tissue and fascial mobility in the chest for some recipients. In others, it may only provide human contact and relaxation. My hope is that this YouTube will inspire others with manual skills to implement them as much as they can in the settings in which they find themselves, whether it be on those with whom you are quarantined or in healthcare settings where you are currently an essential practitioner. If this YouTube helps to save even one life, it will have been worthwhile. Just remember, it is imperative that you do not force the tissues beneath your hands. I would like to encourage those of you who know osteopathically-based techniques to apply those with which you have been trained. If there are osteopathic physicians watching this, please note that the American Academy of Osteopathy has issued a review of additional techniques that they suggest using for the respiratory region. If you are a manual practitioner who has been trained in osteopathically-based techniques and are in a setting where you are seeing patients with COVID-19 or who are at high risk for developing COVID-19, please use the techniques that you have already studied. I would suggest that you add the modification taught above to hold the technique at the barrier for 5 minutes or more to allow for maximal release of the collagen fibers in the fascia. Again, as the barrier releases, let your hands go to the next barrier and wait till it releases as well. Continue this for at least 5 minutes or remain longer if you are still getting tissue releases. The inspiration for this YouTube came to me during Passover, on the anniversary of the passing of my beloved father, Rabbi David Moseson. And this YouTube is dedicated to his memory. My father was a hospital chaplain for most of his career and dedicated his life to helping those in need, particularly the ill. May his memory be a blessing for all of us. My special thanks to my mentors, Dr. Edward Stiles, osteopathic physician, and John F. Barnes, physical therapist, who have inspired me in my life's work. Thank you, everyone, and may you all stay well.